Welcome to the Neural Implant Podcast, where we talk with the people behind the current events and breakthroughs in brain implants in an understandable way, helping bring together various fields involved in neuroprosthetics. Here is your host, Ladin Neurotech.
Hello, everyone, and welcome to the Neural Implant Podcast. We have another monthly news segment with Jim Cavuto and Jen French of Neurotech Reports. And this month, we're mostly going to be covering their Neurotech Leaders Forum, which took place on November 4th and 5th of 2019. Very, very good conference talking about the entrepreneurial side, the business side of the neurotech world. On the second day of Neurotech Leaders Forum, we actually had an editorial roundtable. Very interesting stuff with, of course, Jim Cavuto, Jen French, Jeremy Koff, and Margot Puerta, who are also contributing editors to Neurotech Reports. And the first topic of discussion was responding to criticism. What's the best way to react to negative press about neurotechnology?
All right, let's start with the first session, or the first topic, responding to criticism. We had a lot of discussion yesterday about how do we respond to bad press. AP did a series of negative articles, New York Times. There was, of course, John Oliver's late night diatribe. How do we respond? Who wants to start?
Well, we can't really put our head in the sand. I think at some point we have to respond to this. However, I know we have PR people in the room. Trying to go directly, do a direct response might not be the way to go. But I think if our small little industry, we are just a small piece of medtech device, but we do need to address the problem because it's the elephant in the room when we're talking directly with the public. So I think we do have to find some type of response. What that is.
I'm going to actually borrow from two people I really just respect. One is Jeff Greiner, who's Advanced Bionics president, where in response to bad press, actually from a competitor, his stance was always take the high road.
In the last 4 seconds, we're all trying to do good science, but I do think we need to have some responses.
And that's the buzzer. Okay.
And the next topic of discussion was lessons learned from the opioid crisis. How can we take advantage of the opportunity without falling into the same trap as the drug industry?
What's the lessons we learned from the opioid crisis? Well, if anyone was at NANS in January in Las Vegas, do y'all remember the keynote speaker? It was a journalist who had written a book called Dreamland. David Canoni is a former LA Times reporter. It was a great talk. And he, in his book, tells the story of how the pharmaceutical industry was able to push these drugs on us, on the public, on people suffering from chronic pain, on clinicians, bogus research that said, opioids aren't addictive. Look, here's a paper. And of course, it was a totally bogus study. And, techniques like showing up at the doctor's office at lunchtime, bringing lunch for their staff, okay? And they'd have an army of sales reps that would go out and just infiltrate these physicians' offices and say, look what we've got. And basically all of these things, ethically questionable things, and scientifically bogus claims to really create billions and billions of dollars of sales of opioids. Now, it's taken a decade or so, and we finally learned the lesson. Ironically, after a whole industry, the TENS industry was put out of business, right? Put out of business by the CMS because, we can't afford to pay for electrical stimulation. Why? Drugs are so much cheaper. Yeah, let's look at how much cheaper they are. But what's the lesson that we've learned? Hopefully we've learned that let's not put all of our eggs in one basket. Let's give patients a range of therapy alternatives. I think that's one lesson that hopefully we've learned. Hopefully, let's also learn about long-term costs. Let's look at what's cost-effective. But cost-effective isn't what's cost-effective in the first month. It's the long-term. It's not 6 months. It's not 12 months. It's 2 years, 3 years, 5 years. So we need to be looking at a longer time horizon when we're examining cost-effectiveness of different therapies.
So one of the things I'm thinking is in terms of risk, right? Because the opioid crisis, they were avoiding saying that there was risk, as you point out in the paper, saying that it's non-addictive. And I think we want to just be upfront with the devices that there is risk. And we talked about that earlier at breakfast, that's something that the patients maybe want to think about for themselves.
And let's not deny it that, there's an element of economics that drove us to this point, right? because really when we're looking at reimbursement for pain, it was very easy to be able to easily pay on a monthly basis for a easily prescribable pill. And plus we made it really easy to access. I mean, I live in Florida. We saw all the pop-up clinics coming left and right and all the lines out of that until we finally recognized that there was a problem. But from a neurotech perspective, I think this gives us a level of opportunity. We have an opportunity to say, hey, we've been doing this for a long time. We have good science behind it, and look at our devices as a real option that we can do as an alternative for treating pain.
And for the final topic of discussion is who pays the bill? How can we ensure that reimbursement is available for new neurotech therapies?
I think one of the things that which you alluded to is how in the world do you build a business off of such an unknown variable, right? Particularly when it comes to if we're going to rely on reimbursement for cash flow. So it's really hard to build a business off of uncertain cash flow if we're going to be relying on, right? So how do we build that? I think one of the creative things that we've seen, which, we've seen some of these non-invasive, we're moving a lot to non-invasive and direct to consumer, right? So, you'll see HVV and QVC late at night and, they're pushing a device and why not? So it's helping those sales on it. And, yes, when we start to look at more invasive devices, that becomes a lot more difficult. But is there something that we can learn about going out directly to the consumer and having them advocate for it?
Reimbursement as a driver is certainly one of the biggest considerations for any. I know there's numbers of startup founders here, but very hard to raise money. Long duration to first commercial sale if you don't have reimbursement already in place, and in many cases it's non-starter, and you unfortunately don't see a lot of products. The other point is you could decide, well, I'm not going to go after anxiety, which is going to be likely a prescription-based device, and it's going to cost a lot of money to get there, so I'm going to have to charge a lot of money. Instead, I'm going to do a wellness route where the FDA has guidelines as of a few years ago, was it 2016, where instead of anxiety, I'm going to do relaxation. No regulatory pathway required. I can get there much quicker. I can get there at a lower price point. Same product, but one I had to do a clinical trial and spend several $1 million. The other, no trial whatsoever. I could get to market.
Okay, Jim Cavuto and Jen French, pleasure to have you on the show. We just listened to your panel that you guys spoke at during Neurotech Leaders Forum. Very interesting stuff, some really nice nuggets of information. And I wanted to talk to you guys about some of the awards that you gave out. Your Gold Electrodes, basically honoring those people that have contributed very, very much to the field this year. And so do you guys want to talk a little bit about this and who you give it out to, why you give it out to them, and who won it?
Sure, Lawden, and thanks for your comments. The panel you just played some snippets from. It's the first time we've tried anything like that. It was a little bit of an experiment, but I thought it would be useful to have the four of us, Jen, myself, Jeremy, and Margot, just kind of commenting on things that we've seen, trends we observed over the year, and also topics that came up during the 2 days of our conference. It was an experiment, but it was a lot of fun, and hopefully the attendees got some value out of it. So we gave out Gold Electrode Awards in 5 categories, and the first category was for Best New Product. And this year, the award went to Saluda Medical, an Australian firm. They have a new closed-loop spinal cord stimulation system called Evoke. And Jen, do you want to tell us a little more about why our editors selected this product?
Yeah, so this product is really focusing on new devices that are coming on the market that we believe are going to be game changers in the industry. And, Saluda Medical coming out with the first closed-loop system for spinal cord stimulation, we think is really going to be a game changer and open up the window for closed-loop stimulation. Now, in the past, we've given out the Gold Electrode Award to other spinal cord stimulation devices. Like last year, we gave it out for Boston Scientific's Spectra Wave Writer. And in the past, we've also given it to Nevro for their new SCS device. But we think the big game changer is the fact that Saluda Medical is giving out a closed loop. And in fact, in 2014, the new product award winner was the NeuroPace RNS device, which is very arguably another closed loop system that really is changing the industry in the treatment for epilepsy. So we're really proud to see and interesting to watch how Saluda Medical moves forward with this new system.
The next category for Gold Electrode Awards was for Most Promising Startup. And for this category, the company doesn't have to have a product on the market, but they may well be involved in a clinical trial to get a product approved. And the winner of the 2019 Gold Electrode Award for Most Promising Startup was Naya Therapeutics. And this is a startup that has actually presented at our conference and others with some very interesting technology, brain stimulation technology that will impact both rehabilitation from stroke and brain injury, and also memory impairment caused by various neurodegenerative disorders.
And actually, a quick point too, Dan Rizzuto has been on the Neural Implant podcast as well. And very interesting episode, so I recommend people check that out after this one.
Absolutely. And in fact, Dan Rizzuto was a prior winner of the Gold Electrode for the Researcher of the Year several years ago. The thing is, this is always a fun category to watch because it's a most promising startup. And like Jim said, a lot of these companies that win this award don't necessarily have a product on the market yet. In fact, last year, the winner was Tivic Health, and they didn't launch their product yet. And now they've launched it, and they're off and running. And also a prior winner was Saluda Medical. The fun thing about this is a foreshadowing award where we're saying, hey, here's a startup that we think can really make an impact and really has a good pathway to commercialization. And looking back 10 years, here's an example for you. In 2009, Adrian had a device for hypertension, and they won the most promising startup. And in fact, the next year, they were acquired by Medtronic for $800 million. So there's a promising startup right there.
Okay, so the next category was for Most Valuable Financial Professional. And this year, the Gold Electrode Award went to Josh McElroy, who just happened to be our keynote speaker for this year's conference. And he's from a VC firm called New Enterprise Associates. And NEA has been actively involved in funding some really promising neurotech startups. And Josh, who's a clinician himself, has been instrumental, have been active in various organizations, and has been a real useful professional to help guide the birth of these many of these new companies. And then we had an award category for the most useful nonprofit. And this year, the award went to the Stanford Byers Center for Biodesign. And this is an offshoot from Stanford University that's involved in commercialization, helping startups transition from research to clinical therapy. And so they've been involved in helping several neurotech startups achieve success.
And nonprofit organizations play an interesting role in our neurotechnology industry. And in fact, our prior winners ran the gamut. They weren't just ones that were incubators or accelerators. Some of them are advocates, like MDIC is a prior winner. Some of them are research institutions, like the FES Center or the Feinstein Institute. And even when we look back 10 years ago, in 2009, the nonprofit called Neurotech Network had won this.
Who are they? What do they do?
That's one that you know pretty well, Jen. Okay, and Jen, do you want to talk about the winner of the Neurotechnology Researcher of the Year Award?
This is a coveted award where we really recognize a researcher that's made an impact on the neurotechnology industry. And we are proud to announce that this year's winner is Vanessa Tolosa from Neuralink. And prior to that, she was with the Lawrence Livermore National Labs. And she's done some significant work in terms of brain interfaces and some of the new technology coming forward. And I do want to add, she is the first woman to win this award in the many years that we've been honoring the Gold Electrode Award.
Just to give an idea, some of the other luminaries who've won this award in the past, Professor Michael Merznick from UCSF, really one of the founders of cortical plasticity, was one of our first winners. Warren Grill, now at Duke University, was a winner. Last year it was Eddie Chang from UCSF. So there have been a number of illustrious researchers, but not just researchers for the sake of pure research, but these are investigators who've helped to launch new therapies, new products that have had a significant impact on the industry. We had one Last category of award that we don't do every year. In fact, this is only the second time we've given out a Lifetime Achievement Award. But this year, the Lifetime Achievement Award went to Elliott Krames, and many people will recognize his name as the former president of the International Neuromodulation Society, also the first editor of the journal Neuromodulation, and a person who's been very active and very supportive of both researchers and clinicians and startup firms and in the neurotech space. So we thought it was important to recognize Elliott for his contributions. And we mentioned at the time that the only other recipient of this Lifetime Achievement Award was Alfred Mann, the founder of Advanced Bionics and several other neurotech firms who passed away a couple of years ago.
Yeah, I think that you mentioned a lot of what Elliott has done for the industry, but I think one other key thing that he has been an advocate for the industry in many different ways. And he's also been a mentor to a lot of not just researchers and new startups, but also those that are coming up in the medical field. He's been really a big advocate and educating a lot of those of us that are in the industry today. So this Lifetime Achievement Award is really well-deserved from what Elliott has done.
Yeah, guys, that's very interesting stuff. And I have to say that the conference was very interesting. It's amazing. Sometimes you find yourself sitting at lunch next to somebody and you're like, wow, I can't believe I just talked to this incredible luminary that people, spend years wanting to be able to talk to. And so the caliber of people that they come to this conference is kind of amazing. So very much thank you. I was honored to be a part of it. And do you guys have any final thoughts?
Loudon, thanks for your help and plug. We're hoping to see everyone there in San Francisco next year for the 20th annual Neurotech Leaders Forum.
Hope you enjoyed the show and were able to learn something new, bringing together different fields in novel ways. Until next time on the Neural Implant Podcast.